Hello everyone, this video is a walkthrough of the female genital, maternity, and endocrine sections of the CPT 2022 manual. As always, make sure you have your tabs, your highlighter, your pen. If you haven't already, go ahead and put your tab for this section, which is the pre-made tab, here on page 437. This is a pretty decent table of contents that also has some good illustrations, which can, of course, be helpful during your national exam. And you can't see right now, but this is a labeled illustration. It's a little bit bright in here, but it is labeled. And this can be really helpful, not just when you're trying to code from this section, but if you do have an anatomy question on the national exam, this can really help. So just make note of those. The table of contents is laid out in a fairly logical way, following through, especially if you're looking at an illustration. And then on the next page is, so these, for female genital, it's going to be following by body part. Here. Sorry, I'm trying to get it to not be so bright. And then we have the maternity care and delivery, and then the endocrine system, all kind of nestled in here at the back. And so for the maternity care section, we are not going by body part because there's really only two ways to do a delivery, but we are going by procedure for that section. And it is fairly logical when you look at it as well. We've got the antenatal and fetal invasive services. So that means services performed prior to birth, and fetal invasive would be procedures done on the fetus prior to birth. And then we have excision, which is not part of delivery, but that's going to be excision procedures performed during maternity care, introduction, repair, and then we're going to have a vaginal delivery section, cesarean delivery section, and a delivery after previous cesarean. And that could be vaginal or cesarean. And then we have abortion procedures and other procedures. And then we get into endocrine, and that goes back to being separated out by body part, okay? With those very familiar subsections, incision, excision, removal, and for parathyroid, excision, laparoscopy, and an other catch-all section. Okay, so let's walk through it. And it's a fairly simple, straightforward system. The section is not terribly complicated. I would draw your attention to these sections here at the top of the various subsections or sections that are going to provide pretty good explanations of different procedures. For this one, we're talking about when we are removing part of the vulva, if we have simple, radical, partial, or complete. This helps you understand when to use each of those codes. So I would just draw your attention to it, make sure you know what that is, because you'll likely code at least once from those code sets, either in your homework or national exam or somewhere. And then as you go through, you'll see our sections are going to be, again, the body part, and then underneath is going to be the procedure. There's really not a lot of like trick sections in here, so I'm not going to spend too much time on it. Yeah, the only thing you might see frequently is colposcopies. And those are just specified as with or without biopsies. And that you'll likely see pretty frequently. Then we do have a laparoscopic section here. Always remember Surgical laparoscopy always includes diagnostic. That's one of the main ways you can get tricked up. There is a section just for in vitro fertilization. And that starts on page 449. So that does have its own section, even though that's obviously not a body part. And then on the next, and then there is an other section, I guess I should point that out. There is an other procedure code here at the top, at the very, very end of the female genital section. So you can get that. Yeah, so there's just one code that is like kind of a catch-all code there. And then we get into the maternity and the delivery care section, which I feel like a lot of people are hesitant about or get anxious about. And it just takes a little bit of practice. I don't think it's too terribly complicated. Yes, I have a lot of things highlighted here, but that's just for my benefit. And you might not necessarily need to highlight all these things. It might all just make sense to you, but I'd read through it and make sure you understand it. Because it does provide some good explanation of when to use specific codes. One thing that might be helpful to know is, so we have these codes for antepartum care, so codes for care prior to birth. That's what antepartum means. And the important thing to note about that, or hear from this little section here, is if a pregnancy is confirmed during another visit, so a problem-focused visit or a preventive visit, the patient is not going in specifically for antenatal care, then we would not code it using an antenatal care code. We'd use it using the appropriate E&M service code, and it gives you a whole list of ones that you could possibly use. So as long as you understand that, so say they went in because they're having stomach cramps, they don't quite know why, they don't know what's going on, and then during that service, they find out that they are pregnant. We would not use just the regular antepartum care code for that. We would use an E&M code, okay? And one of these. So, and those are going to be mostly just related to those will be regular E&M codes. Those are problem focused or whatever. Or if it's a preventive visit, they're going in for just their routine annual visit. We would just use that code if we discovered that they were pregnant during that visit. This section right here tells us what we would use, when we would use that antepartum care codes, just for like the routine services. And that's going to be usually, so yeah, it's monthly visits up to 28 weeks, every other week up to 36 weeks, and then weekly visits until the delivery, okay? Then we get into the delivery services, and this explains a little bit about when we use specific delivery service codes. And let's see here. And then we may have, what I think gets people worked up is if there's a complication during delivery, because there's fairly straightforward delivery codes here. That's not, it's not terribly complicated or difficult to apply. But then once you get into the complications, they had some kind of emergency. When do we use a different code? So some things that you want to point out here is that if the mother, the person giving birth, had an episiotomy or had forceps or even had like a vacuum delivery, that is still part of an uncomplicated delivery, uncomplicated vaginal delivery, okay? So those are going to be the most common complications that you'll see, but they would still be coded just along with a regular uncomplicated vaginal delivery code. So don't worry too much about that. You might want to make a note of that for yourself. Cesarean delivery, the thing that I think people get tripped up on that is if it's multiples, if we have twins or triplets or more, how do we code that? So if you are going to have multiples and you're having a cesarean delivery, which a lot of the time, if you're having multiples, you will, we would code one cesarean delivery for that. Okay. And then if we do have other complications, say there's some kind of emergency, unrelated necessarily to like just how we've removed the infant, so it's a forceps, vacuum, that kind of stuff, episiotomies, things like that, then we can code those separately. So say that there needs to be an appendectomy during the delivery, which does happen quite a bit, we would code those kind of complications separately, particularly if they are exclusively affecting the mother, and are not just part of removing the baby. So let's go through this. So like I said, like this section's really good. Yes, I've highlighted it a lot, but that's just because I find it really helpful. I would read through it and highlight and make notes about what works for you. Again, it's a really, really short section. You're not going to code that much from it for the national exam. So don't get too bogged down in all the details and all the minor little complications that you can get into, okay? So our first section is antepartum and fetal invasive services. So antepartum, like I said, is going to be services prior to birth, and fetal invasive is going to be procedures done on the fetus prior to birth, okay? And this is going to include a whole lot of different things, including amniocentesis, and that's when they are removing some of the amniotic fluid. Our first code, here if we can see it, is diagnostic, and our second is therapeutic. So what does that mean? So we can do an amniocentesis in order to obtain some of the amniotic fluid in order to test it, right? And then we could also do it for a therapeutic reason. Maybe there's a reason that we need to have less amniotic fluid. And that would also include our ultrasound guidance when we use that code. So that is how we would separate those out. Try to see what else we have in here. If we have any other procedures done on the fetus or any other testing done on the fetus, that's going to also be in this section. And there are occasions when that does happen. So you can, and this can even include like fetal monitoring, stress tests, non-stress tests. If we do blood sampling, that can also be in here as well. So these are things that can be done. Most of the time you'll see if they're going to do some kind of drainage or placing of a shunt or something like that, that's what you'll usually see performed on a fetus prior to the delivery. It's super bright in here. I'm trying to make sure you can see everything. Then we have an excision and introduction and repair section. And those are going to be for various procedures that might be done. If we are going to have things like, okay, so an excision, we're going to have surgical treatment of ectopic pregnancy, if that's tubal or ovarian. So this is an ectopic pregnancy is when the egg implants outside of the uterus and it has to be removed. So that would be part of an excision procedure. For our introduction, we only have one code here, and that is for the insertion of a cervical dilator. So if we need to, for whatever reason, dilate the cervix, we would use that code from the introduction section. And it also provides some guidance for things that you might think might be in the introduction section, but are not for this portion. And then we have a repair section. And this is a little bit complicated because there are codes in here for things that happen prior to the birth or things that happen after birth. So it's not necessarily one or the other. So our very first code is for episiotomy or vaginal repair. So that is after the birth if we've done an episiotomy, or just there's natural tearing and that requires some kind of repair. Then we do have a code for that. But then there's things like the cerclage, and that is a So we can have abdominal or we can have cervical cerclage, and that is prior to birth. So that's a repair that's done prior to the birth. So it's not necessarily before or after birth. It's not one section for that. Okay. All right. And then we have our delivery sections, and we have a vaginal section, and this includes some antepartum and postpartum care. So that's where you're going to have like your routine obstetric care is in here. And then cesarean delivery, which again is considered routine. And then so when I say it's considered routine, it means we do have routine antepartum care, postpartum care codes for cesarean delivery because they are not all emergency situations. They can be planned, particularly in the case of there's a pre-existing condition or multiples or whatever other reason. So we do have a routine care code in there as well. We also have a section for delivery after previous cesarean, and that can be VBAC, which is vaginal delivery after a cesarean, or it can be a secondary cesarean. So whether or not the patient is having a cesarean or vaginal delivery after a previous cesarean, we would code from this section. Then we have abortion procedures, and I want to make sure everybody understands that abortion is a medical term. It can relate to a spontaneous abortion, which is also called a miscarriage. And for those procedures, we are sent to these other codes. So make sure you read that guidance here at the top. And then there can also be other planned procedures, and these are not all elective. They're not all emergency surgeries, anything like that. So it can be a whole different host of reasons why we use that term. So I would make sure that you are approaching this without judgment or without any preconceived notions about why you would use one of these codes, because that can get problematic. So remember, we are professionals and we are coding the actual procedures. We're not making any judgments about why or why not that was a necessary procedure. And then here at the bottom, we do have a catch-all section that has some other procedures. All right. And that's also going to include the evacuation of if we have a molar pregnancy. That's where that code is. Okay. And on the back here, we have some other, this is a continuation of that other procedures section here, that unlisted. Okay. So, and that also includes like if we have an unlisted fetal invasive procedure, that's so one of those things that was not covered in that section, that would be here as well. And then we get into the endocrine system, which is a very, very short system, so we can cover it very quickly. We just have two different sections here, and that's the thyroid and then the parathyroid and associated structures. Okay. And then we have that very familiar incision, excision removal, excision, laparoscopy, and other catch-all. Okay. So for this section, there's not a ton of guidance. But I would just make sure you are looking at our really great illustrations, because these can help you know what we're talking about. And there's another one right here. Okay. So if you do have questions about this section, go ahead and post them in the discussion and we can talk about them. But I just wanted to point out that this section exists, that it's here. If you want, it might be helpful to make another tab and put that in here. So I would make a tab that just says endo or endocrine and put it in here. Right there. All right. Okay. And that's it for that section. So if you do have questions or concerns, please let me know and we can walk through some of those. But that's all I have for you now. Thank you. Bye-bye.